Last June, Brookline Select Board, in the midst of public outcry, made a symbolic gesture to shift $166,000 in police overtime to other purposes related to social services. Soon after, town meeting rejected more substantive cuts to the police budget, with many citing the need to know more about how these funds could better be spent. I had, prior to the select board and town meeting votes, proposed a reimagining of policing and public safety more broadly, one that would explore, propose, and recommend investing in alternatives to policing where appropriate. There were several key tenets embedded in that proposal. First, that a community holds the power to determine its own approach to community safety, which includes determining if and how police should be part of that approach. Second, that there are members of our community and those in our neighboring communities for which Brookline's current model is simply not working, and that's unacceptable. Third, that police need to be held to the highest standards, and we need clear accountability measures for what happens when officers fail to live up to those standards. And finally, that this moment is an opportunity to rethink our relationship with police, yes, but also to reconsider how we invest in the long-term well-being of residents and neighbors. As you've seen tonight, our task force, which conducted a robust community-wide study, met with countless experts and residents over more than 6 months, has held now 6 public hearings. This is our 7th. This task force of Brookline residents, after a deep and thoughtful examination of the current state of affairs, is proposing a new way forward. We propose that the social service needs of Brookline residents in our schools and public housing and elsewhere should not be addressed by the police, but rather coordinated through a new social service agency. The focus of this agency will be to address both the symptoms as well as the root causes of inequities. And the name Brookline Forward is a placeholder. Brookline Forward will provide residents with the services and supports they need to thrive. A new innovative department of the town of Brookline, Brookline Forward, will partner with the Brookline Housing Authority, the Public Schools of Brookline, the Brookline Senior Center, and local social service agencies to deliver timely, critical services while conducting research, analyzing data, and implementing programs designed to counteract economic, health, and other inequities deeply rooted in racism, sexism, ageism, and other forms of oppression. This agency will restructure and expand social services by bringing together existing offices under one umbrella, including the Office of Diversity, Inclusion, Community Relations, the Council on Aging, and the Office of Veteran Services, while also establishing a new office addressing the needs of youth and families that's been well discussed tonight, as well as immigrant and refugee services and economic equity. This new agency will also provide staff support for the Domestic Violence Roundtable, the Commission for Women, the Brookline Commission on Disability, and a new council on LGBTQIA+ inclusion. Brookline Forward will also partner with other town departments as necessary to meet community needs. That includes working with Health and Human Services to develop a mental health incident response team, with the building and fire departments to ensure residents are living in safe housing, and yes, with the police department on diversion efforts for youth. This agency will be funded by municipal dollars, including funds shifted from the police department, as well as local, state, and federal grants. In addition to existing personnel, new staff at inception may include 1 administrator and 3 professional staff members, as well as a new commissioner to lead the department. Through our work, what we found is that the police department has been engaging in social service work, and primarily the reason they've been doing that is because they were filling a vacuum, they were filling a void where there was not enough attention, not enough funding, not enough resources to address what are some pretty significant issues relative to particularly youth and families, but others in our community as well. All of the work that we saw throughout our subcommittees really led us to a place where, if we think, and we do, that social services are or should be an important aspect of what we do as a community, and particularly as a government, then we should put our resources directly in that way. That even at their best, what police are doing are addressing the symptoms of inequity, and that we think, in addition to providing staff that are better trained to even address those symptoms, that we also can do better by starting to address the root causes of those inequities. And so in comes this proposal for this social service agency.
I just think we really need this. One thing that we've been hearing ongoing in our task force work from the Brookline Police Department is that they are doing a large number of these services because nobody else is. And this is a way of having folks who have a background who've been trained in community outreach, community support services, whether it's the walk and talk model, whether it's crisis intervention services, whether it's other types of services and supports to the community, actually be able to do this work and free up the Brookline Police Department to do the jobs that police departments do.
Right now, unfortunately, the amount of social services that go to people of color through the police is a barrier. It's a barrier to access to services. And we just have to look at that and say, how do we do that better? The people who need to come in to do services for people are, one, people who are not in police uniforms, who are not carrying firearms, and do not have a history of being difficult for the people who need the services.
Earlier on in our meetings, when we talked about this, and in particular the total lack of correlation between spending on policing or the size of a police force and the safety of a community, that there is no correlation between the two. So in reality, there are a number of factors that lead to Brookline being a safe community, external to policing.
And this came up in a comment in our hearing last night, is that someone asked us to reframe how we were thinking about pre-crisis services, because they were talking about, you really need to be thinking broader than this.
Public safety shouldn't just be understood as solely reactive. And I would actually push your definition of pre-crisis services a little wider to include things like high quality, equitable pre-K through 16 public education, expanded public housing opportunities, Medicare for all, right? Essentially not just acute pre-crisis services, but universal basic rights that we know are at the root cause of quote unquote crime prevention. And I think making this connection for the wider public is crucial in ensuring long-term public safety.
Because pre-crisis services is about employment. It's about housing. It's about access to healthcare. It's about fighting the many pressures that poverty puts on people. And I think that person was completely right. And I was sort of sitting there being like, that's true, and that's important for us to be framing things that way. And also, I can't wave a magic wand and solve those problems, unfortunately. But a social services department would go a really long way to helping with those kinds of problems. And I really believe that until we work on those, until we take all of that seriously, we listen to what that person said, in a lot of ways, we're going to be dealing with symptoms in terms of what makes people call the police in the first place.
There are communities that I think are recognizing that they need to change their orientation to these problems, the root cause orientation versus the symptoms orientation. It's going to be a longer term effort to actually meaningfully reduce and ultimately eliminate the inequities that we're talking about. A generational problem, to be sure. And so I think, an approach that only addresses the symptoms, I think is one that believes at least tacitly, that these gaps will always exist, that there will always be racial gaps, there will always be these economic, they're just simply part of what our society is, and we'll do our best to help folks out when they really, really are down. Like that can't be our orientation. And we see a lot more communities that are starting to experiment.
But I'm a social epidemiologist. I deal with data all the time, and seeing such a heavy data-driven, evidence-driven work being conducted, it's truly notable. And I love that you looked at good examples in other towns and other parts of the country. And this is really helpful. So first of all, to say thank you. Second, to say that I fully support this vision of a Brookline Forward. We're in the midst of a pandemic when the social kind of mental health crisis that we're experiencing, we're going to feel it for a long time. And this is a gap that you have identified. You have identified a gap in sort of how we respond to social isolation, to crisis, and the police is simply not equipped to deal with that. So I think this is the moment to be pushing for a vision for a Brookline that really meets the needs of children, of elderly, of families, of people in crisis.
This will make more of Brookline citizenry feel safe. That what we're saying in this reimagining is actually asking for all of our citizens to feel closer to feeling safe all the time. And that this is my belief, that reforming the existing system does not do that. It does not increase the overall safety of all of Brookline citizens.
And this seems very basic, but like maybe a clear articulation of why the nonprofit charitable sector is not sufficient and requires this kind of investment from the town.
I just want to go back to Eitan's point, because I think about my debate training and like trying to anticipate what the other argument is. And I feel like that is what Eitan's bringing up is actually an age-old argument, right? I mean, this is, this is Carnegie talking about like the responsibility of industrialists to provide, security for their communities, like that, and especially in a town like Brookline. Like, it's too visceral for me because literally I was just teaching, maybe I don't know this, Booker T. Washington came to Brookline High in 1894. And when Booker T. Washington visits wealthy liberal communities, he's here to get their pockets to keep Black people in the South so they can go to those Southern HBCUs and stay there. And so, especially in a wealthy town like Brookline, I feel like we're going to get a lot of pushback saying, well, like, can't somebody just donate some money, or like, can we create an organization? And Raul, what you're saying is very real, because I work with both the Teen Center and Steps to Success, where, they're beacons that we shine to the rest of the world and say, look how well we do, look at this. And they're literally scraping for pennies. I think this is an opportunity for our government, for our institutions, to build trust in more of our citizenry.
I think there's a particular benefit to a coordinated response, right? Like one of the, I think, strong, like as Malcolm rightly points out, this is very much an age-old argument. We can look to history here. And one of the things I think that's been really beneficial historically in these arguments happening across the nation is that whenever you have a network of private organizations, there's nobody whose job it is to coordinate those services, right? And so they can each decide individually how much they want to take on in particular aspects of a wide range of social and economic, et cetera, problems. And they're scraping for pennies. There's only so much anybody can do. And these are organizations that are designed to fill gaps. But in order to survive, you pick a certain gap and you roll with it. There's a dozen that aren't being covered, and there's only so many meetings you can have to talk with one another. So I think that coordinated response is really important, and that's one of the things that a government agency can do. And also, just to sort of pitch in on I think there's an argument to be had here about the proper role of government, right? And to me, I think it's really important to recognize that at the end of the day, like, especially like as somebody who was very much raised in a conservative family with all these ideas about like, oh, government is basically for mutual self-defense and that's about it. All a government actually is a bunch of people in a society making mutual agreements about how we want to live. That's it, right? And if it weren't done through government, it would be done through some other like community organization that we wouldn't call a government. That's all this is, right? It happens in small groups, happens in big groups. When it gets to groups this large, structures get into place. And so we as a society need to ask ourselves, how do we want to address the problems that we face? Do we want to leave it entirely out of our own hands, like the people who we've put in charge of solving community problems? And I don't think that we do. I think we want to tackle this head on.